This is Matt Walsh with your Minute with the Mayor for Tuesday, June 9th. A month ago on the Minute with the Mayor, I referenced Nicholas Reich, who is a biostatistician at the University of Massachusetts Amherst. Reich and his colleagues had developed a method to compare and ultimately merge diverse predictive models into one ensemble projection that helps predict the effects of disease progression. Reich's predictive approach builds on the work that he had done over the last 4 years with the Centers for Disease Control and Prevention, where he pulled together many differing forecasts that U.S. experts create annually to predict how each year's seasonal flu will play out. Reich took his influenza prediction model and applied it to the spread of COVID-19 in an effort to predict the future numbers of fatalities related to that disease. Reich took his influenza predictive model and applied it to the spread of COVID-19 in an effort to predict the future numbers of fatalities related to that disease. The time horizon of Reich's predictions extend only 4 weeks in duration because the multiple predictive models incorporated into the ensemble vary in terms and conditions, and only a short 4-week time frame can incorporate all the data sets of these models. The projection forecast 4 weeks ago, when I first referenced it, predicted that by June 8th, the cumulative death toll in the United States would reach 113,000. Yesterday's real-time statistics compared to his month-old projection showed he was almost spot on, because the actual death toll ended up being 113,061. Since such accuracy begs the question, what is Reef's forecast for the next 3 weeks? Please note that the model's most recent 4-week prediction was made on June 2nd, or what is the prediction for June 27th? Reef's model predicts 127,230 deaths. We currently are now in the 24th week of the COVID pandemic. Through the first 12 weeks, nationally, the epidemic only claimed 58 total U.S. lives. As stated earlier, the next 12 weeks, that number has now climbed to 113,061. On average, that is 9,417 deaths per week for the most recent 12 weeks. Doing the math, if the projections of Reich's model are indeed accurate through the end of June, it is predicting an additional 14,169 deaths. That's a weekly average of 4,723 deaths per week. It would appear that even with U.S. businesses reopening their doors, the fatal effects of this disease are declining in magnitude as we move into summer. Iowa's numbers didn't begin to climb until week 15, when the state had a total of 15 deaths. Yesterday, Iowa recorded its 600th death. Reich's predictive model had forecasted 619, again, extremely close to the actual number. The bad news is by June 30th, Reich predicts 895 deaths in Iowa, a difference of 295, and a weekly average of 98. In Iowa, in the last 9 weeks, since deaths began to rise, on average, we had experienced 65 deaths a week. The prediction is an additional 33 deaths per week, or represented as a percentage, 50.7% increase in our recorded weekly number of fatalities. So the good news is, over the next 3 weeks, the United States experts are projecting that a 49.8% average weekly decline in deaths. The bad news is here in Iowa, that same group of experts is projecting a 50.7% weekly increase in recorded death. This is not the time to give up on prescribed health protocols. Continue to wash your hands. Clean hard surfaces and doorknobs and toilet handles. Social distance. Only go out when you need to. The numbers, as reported today, correlate with the narrative about Iowa. In Pottawatomie County, we have had another 55 positive confirmed cases. Again, we are testing more, and so it's reasonable that the test confirmed numbers go up. 437 total, 178 currently self-isolating. Only 6 of those are in the hospital. The deceased number stays the same at 10. 234 have recovered. Numbers between male and female are pretty evenly dispersed. 226 male, 211 female, of 437, 318 are between the ages of 18 and 60. That's your Minute with the Mayor. Be safe out there. Do something kind for somebody.